Okay, good afternoon, everybody, and thank you for joining. My name is Stephen Hindle, and I am the MR Digital Education leader for the UK and Ireland. Today, we're going to highlight the key features that are available with the HD28 Upgrade program, otherwise known as the HD28 Upgrade. First of all, I just want to check that everybody can hear me okay. So I'm just going to pop a little poll across onto the screen. If you could just answer just to make sure that everybody can hear me okay. We've got one person that can't hear or hasn't answered. Okay, so you can see here that we've got the Q&A function. You can put your questions in there. I would ask that you don't ask any questions until we've completed the presentation, if that's okay. This presentation will also be added to the gecares.com website as well, so you can always replay this at your own leisure. Okay, so let's get started. So, what exactly is HD28? So as part of our commitment to the SIGNA Continuum, we are proud to announce that you can get the works with the 1.5 SIGNA HDxt SIGNA upgrade program for eligible HD systems. The HD28 system upgrade, which will be the software level that you would jump up to, allows you to reset the life of your existing scanner with new applications and the latest generation hardware. HD28 Upgrade provides the answers to the biggest challenges that we often see in the current market. HD28 addresses precision health throughout the entire workflow of planning, scanning, and diagnosis through the use of intelligent software, new devices, and useful services. The result is an increased throughput through fast, consistent, quantifiable results in a workflow that adapts to any patient. And this can all be achievable without having to buy a brand new scanner, which is always good. So what I mean by this is that your current scanner will stay the same. There will be your current magnet will stay the same. There's no need to purchase a new magnet. This would be good. Obviously, there's no construction costs and construction time. Obviously, there'll just be the upgrade time. So there will be some minor disruptions, but not as much as if you were going to be installing a brand new scanner. And also, you'd need to make no modifications to your existing Faraday cage. Okay, so it should take between 4 to 6 days for an upgrade. It's relatively simple, straightforward. You do have the option to replace the magnet covers if you wish, and also the table. But that's not, you don't have to do that if you don't want. So what does it actually include? So HD28 will open up new capabilities of scanning with the use of SIGNAWorks. SIGNAWorks opens up new innovative applications and improved workflow, allowing for higher productivity and increased throughput, with the potential to accelerate exam times up to 50% with the use of HyperWorks solutions. Your existing scanner will have a brand new receive chain. As an example of this, if your current receive chain has 8 channels, with HD28 you will now have 16 channels. If your existing scanner already has 16 channels, your HD28 will now have 16 better channels, which will include optical RF technology known as optics RF, which provides an increased SNR, which we've measured up to around 27%, which I think is quite impressive. Essentially, this means that if you were to run your same baseline protocols, you would instantly see a marked improvement. There'll be 3 new computers, a new host computer with the latest software platform, which allows for the use of flexible no-phase wrap, small frequency field of view imaging, improved standard pulse sequences, and improved workflow. We'll get a new reconstruction computer, which is our latest and most powerful Generation 7 reconstruction engine, and a new sequencing computer in order to support all the new software capabilities. As I stated earlier, new magnet covers and patient tables are available, along with a set of 16 channel flex coils, and also a number of high performance imaging applications. So in this slide, we can see the evolution of sequences available over the last 15 years and the new options that are available with HD28. We can gain advanced clinical capabilities through some of these available options, such as, and we'll just run through a few of these briefly. We've got HyperSense, which is a new compressed sensing acceleration technique for 3D imaging. This is particularly advantageous for volumetric acquisitions, and it can be combined with other acceleration methods such as ARC to guarantee an optimal signal-to-noise ratio with shorter acquisition times. We have Hypercube, which also allows for increased resolution without an increase in scan time. We have Magic. Now, Magic is in the brain, when we talk about Magic in this sense, which delivers multiple contrasts within a single image acquisition. We also have Magic DWI. Now, this is different to Magic, but this allows for high B values to be acquired synthetically. So very, very useful in the prostate, for example. We have Propeller Multiblade, which is now for all body parts and is available in all planes. Flex for fast spin echo and for cube is a 2-point Dixon technique, which we can acquire 4 contrasts with within one image acquisition. Very, very useful for areas that are inherently difficult to fat saturate. The 4 contrast images that we would get are in phase, out of phase, water only, and fat only. We now have Disco. Disco provides an extremely rapid 4D dynamic sequence. And we have Focus, which allows for small field of view diffusion weighted imaging, which also has an increased resolution. And finally, Maverick SL. Maverick SL, you may have seen or heard about, is a composite imaging technique. And this is for imaging soft tissue around MR conditional implants. So we would use that alongside our normal metal suppression Mars type sequences. Very, very useful. Okay. So SIGNAWorks is the latest software platform provided by GE. It includes the base pulse sequences, workflow enhancements, and visualization tools to enable high productivity with exceptional quality and outcomes. Several optimized work categories listed here. GE delivers preset protocols for most demanding neuro, MSK, cardiovascular, body, oncology, and pediatric areas. In addition to enabling the routine imaging, SIGNAWorks provides you with a streamlined and efficient operating environment with inline processing through single-click outcomes for even the most demanding of processes. So here we're going to look at our NeuroWorks first of all. So NeuroWorks enables us to image the brain, the spine, vascular and peripheral nerve anatomy. The package includes the basic imaging acquisitions and processing, as well as the latest in motion correction, functional, and volumetrics. Here we have some of the new imaging techniques available within NeuroWorks for increased contrast and functionality. that HD28 can provide. So first of all, we have propeller DWI. This is a motion correction DWI technique, which is fast spin echo based to minimize distortions at the skull base or near MR conditional implants. We now have arterial spin labeling, or ASL 2.0. This provides a non-contrast perfusion scanning technique with automatic CBF map acquisition. SWAN 2.0. This is a susceptibility weighted angiography technique. This sequence is highly efficient in the detection of microbleeds and is often preferable to standard gradient echo brain sequences, although it does take a little bit longer. We have focus DWI, as I've already mentioned. This provides a high resolution, small field of view diffusion imaging technique. For increased speed, HD28 provides magic for the brain. As again, I've already mentioned, this could provide up to 8 different contrasts with one scan acquisition. And magic diffusion will allow us to scan synthetically acquired high B values. However, it allows us to do this by keeping the same SNR that we would acquire for lower B values. We have hypersense, which is a compressed sensing acceleration technique, which will allow us to aggressively increase acquisition time for 3D time of flight imaging, and also 3D cube without any loss of SNR. NeuroWorks has some innovative workflow solutions also. Here we list a few of them. We have ReadyBrain. ReadyBrain provides the flexibility to automate the brain exam, requiring a localizer image to prescribing acquisition planes, scanning relevant series, performing post-processing and transferring the final image data. ReadyBrain is designed to automatically detect the mid-sagittal plane for 2D and 3D prescription and determine the ACPC line. It will also correct for extreme tilting around about 45 degrees. We have flexible no phase wrap. Now this is very, very useful. Flexible no phase wrap allows for a percentage of oversampling to be added in the phase direction to cover any tissue outside of the field of view in order to avoid wraparound artifact. This means that the area, could be a much reduced scan time if there isn't as much anatomical area outside of the field of view to be scanned. So, for example, we wouldn't need to turn no phase wrap on to 100% anymore. We could essentially just use a percentage to cover the area of anatomy outside the field of view. We also have automated inline post-processing. This means that the post-processing technique can now be built into the sequence, either as a save within the protocol, or this can be done during live scanning. This means that the technologist will have no longer have to use valuable time to perform post-processing techniques after the scan is completed. Okay, so here we can just see an example of flexible no phase wrap. So flexible no phase wrap in combination with phase oversampling can be used to optimize spine imaging by creating a smaller rectangular field of view to focus only on the area of interest. The same resolution can be kept by lowering the matrix, thus decreasing scan time further. And we can just see here the scan time here is 3 minutes, and it's considerably lower when we are using the flexible no phase wrap. On this image here, we've just got it's just an example of the scan times that are available for brain imaging. We can see the capabilities to scan high resolution brain imaging under 5 minutes by employing some of the features of the upgrade. So here we can see we've got a 38-second axial T2 motion correction sequence. Again, T1 propeller, very fast. And the image quality here on the time of flight, which is done in 1:38. Again, very fast imaging with very good resolution. These images highlight the different image weightings available with a single image acquisition using Magic. So here we can see we've got T2, PD, T1, stir, T1 flare, T2 flare, PIR. All these are available within one image acquisition. Okay. We'll move on to OrthoWorks. So OrthoWorks also has a number of exciting features for excellent tissue contrast in MSK imaging. We've already mentioned Maverick SL. I'll just go into it a little bit deeper. So Maverick SL is a composite imaging technique that helps to reduce metal artifacts and complements the information for fast spin echo imaging. Its use may help radiologists or orthopods to evaluate arthroplasty complications, visualize fluid near implants, and confidently diagnose adverse local tissue reactions, as well as imaging MR-compatible implants, which it's very effective at doing. Maverick has also been shown to improve visualization of the periprosthetic bone, synovium, and the regional tendons compared to fast spin echo sequences. This is also available. We can get Maverick with the use of PD, stir, and T1 weightings. We now have Cube Stir, which is a 3D isometric stir sequence. The sequence can be reconstructed in any plane and can be used in conjunction with Hypersense. So this technique has been found to be very useful for neurography imaging. To increase the ability for robust fat saturation technique, HD28 has the option for Flex for FSE and Cube. Again, we've already mentioned this, but this is a 2-point Dixon technique, which we acquire for contrast with one imaging acquisition. It's very useful in areas that are tricky to fat saturate. As for an example, the brachial plexus, or in the knee, potentially. We also have Propeller Multiblade, which employs a multi-shot technique to acquire multiple echo train lengths, oversampling the same area in order to reduce motion artifacts. Again, we have 3 16-channel flex coils that are available and can be used in most areas of the body for imaging MSK. These come in small, medium, and large, and provide a comfortable and adaptable solution to scanning with, instead of scanning with heavy and sometimes what can be deemed claustrophobic dedicated coils. So these coils can be used on the knees, the elbows, the shoulders. Basically, you can put them anywhere that you can fit them. We often scan brains with these coils. Very good in the for TMJs. So here we can just see some nice imagery that's been scanned with our flex coils. So I think these images generally just demonstrate the durability and adaptability of the 16-channel flex coil. We can note the detail on the plantar aspect of the ankle, which can sometimes be very difficult to visualize using some of the older fixed coils. As I said, these provide a particularly unique, adaptable, and comfortable solution to many types of scanning. Here we can see a comparison between a coronal T2 FSE on HD16 and a coronal T2 propeller with the 28 upgrade. Note the clarity and the sharpness. The propeller is scanned with 3.5mm slices also, and is over a minute faster, with no movement artifact whatsoever. I think you can certainly see the details in the humeral head. So let's move on to Bodyworks. The Bodyworks package provides numerous imaging techniques that can provide excellent image quality, as well as technologist work solutions that assist in the acquisition of an abdomen and breast for both male and female pelvis. DISCO, which is a sequence, stands for differential subsampling with Cartesian ordering. This is an extremely rapid 4D dynamic imaging method. It uses some of the similar K-space acquisitions to TRICS by subdividing K-space into several annular elliptical regions that are randomly and incompletely sampled together with a central region that's consistently sampled. DISCO is primarily used for dynamic contrast enhanced studies of the breast, liver, and prostate. It's very, very fast and is very, very useful in the detection of small lesions because it has higher spatial resolution and less blurring, and can reduce the length of time. Can reduce the length of breath holds for patients. We have MR Touch, which is a non-contrast, non-invasive technique that applies pneumatic pulses from a passive driver, which is placed on the outside of the body to establish the elasticity of liver. The sequence is easy to perform with no pain, and it only has very, very little added time. It's very, very useful in the detection of cirrhosis and liver cancer. I think this sequence takes between, from personal experience, maximum 20 seconds, but I think it can be done in around 6 to 8 seconds. So again, very, very good piece of equipment to have. Ideal IQ. This provides volumetric whole liver coverage in a single breath hold and generates estimated T2 star and triglyceride fat fraction maps in a non-invasive manner also. Is intended for breath hold abdominal imaging to evaluate diffuse liver diseases such as hepatic steatosis of the liver. We also have a number of workflow solutions such as free breathing, or auto navigator, adjust real time, auto voice commands, and automatic bolus detection to allow for a much more fluid examination. And to allow technologists essentially to focus on the patient more instead of having to over-concentrate on the protocol building technique. So again, here we can see it's got an image of an MRCP. This 3D coronal MRCP has been done using Hypersense. It's almost 1 minute faster. The image IQ is, if not, I would say possibly better than the old 3D without Hypersense, but at a fraction of the time. The images depicted in this slide here, they demonstrate some abdominal imaging that has been acquired when using the auto navigator. Again, very, very nice images. The tracker can be linked or copied onto the additional series, as well as this basically, provides less mouse clicks, a much nicer technologist workflow. This can be also saved into the protocol as well. So these can be set up and essentially ready to go. With the Bodyworks package, we have specific women's health imaging techniques. Again, we have the ability to produce small field of view, high resolution diffusion weighted images, as well as homogeneous fat suppression images with the use of flex. We can also acquire 3D isotropic imaging with the use of hypersense to greatly reduce the scan times for a procedure that can cause a lot of anxieties and can be very, very uncomfortable for patients. Vibrant stands for volume imaging for breast assessment. It's an extremely high resolution 4D dynamic imaging technique, and it has the ability to individually fat sat each breast, plus the added capabilities to scan bilateral sagittal and bilateral axial breasts. So again, a very, very useful tool for a procedure that can be potentially very, very worrying for the patient. Get that done nice and quickly. Again, we have some specific sequences for men's health imaging also. As I'm sure you're all aware, prostate imaging is one of the hot topics around at the moment. And for us to be able to provide a good diagnostic is essential. As mentioned earlier, Focus is a 2D spatially selective RF excitation method for DWI and provides higher resolution DWI scans where the area of interest is small in the phase encoding direction. In the prostate, Focus can assist in the detection of small lesions that may be obscured by distortion or possible susceptibility artifacts. With the new SIGNA Works application, such as Focus DWI, Magic DWI, Hypersense, and HyperCube, you can be a lot more confident in delivering the accurate results for a challenging multi-parametric prostate examination. SIGNA Works also has the option for ProView, which is a post-processing tool that will allow radiologists to be able to create PIRAD score following multi-parametric prostate imaging. So again, very, very useful tool in order to get very, very quick results. Again here, we can just note two images. We've got an axial T2 fast spin echo sequence. This has been scanned in nearly 4.5 minutes. In comparison to a axial T2 propeller multi-blade, which has been scanned in under 3 minutes. So again, if we can see we can see a lot of detail within that propeller sequence, and a lot nicer contrast as well. So again, two images here, just highlighting the clarity, the sharpness, and the quality and contrast quality. Sorry, when doing our using the propeller multi-blade sequences. We have a sagittal T2 propeller, the female pelvis, the coronal T2 propeller, the female pelvis. So moving on to our CV works. To aid standardization of cardiac MR, the Society of Cardiovascular Magnetic Resonance released cardiac MR exam protocol recommendations for the most frequent CMR procedures for MR imaging of myocardial infarct and stress MR, coronary MRA, and more. CV Works provides GE's extensive coverage of the latest techniques enabling high-performance cardiovascular imaging outcomes. We have single breath hold imaging for whole heart coverage available, from morphology to delayed enhancement, enabling simplified generation of superb results, including head-to-toe MRA, which support to single acquisition time of flight, and additional non-contrast imaging for flow. These are all available with SmartPLEP and with fluoro triggering, for first-time contrast injections. So again, very, very useful. Okay, we also have 4D flow. industry-leading 4D flow available across the entire portfolio. Again, a very, very useful tool. And the HyperWorks. Now, we've talked a little bit about HyperSense and Hypercube. Just go into it again a little bit more detail, just to understand what exactly is happening when we're using HyperSense. So HyperSense is a compressed sensing acceleration technique that relies on the principle that sparse data can be compressed without losing the ability to depict the original data. So as an example of this, what we're saying is that the scanner is able to look at an image and essentially undersample that image and be able to know what that image should look like. So here is an example that we can see the Eiffel Tower. Everybody, even if we don't know what that image is, we know what that image is, as will the scanner. So this is how HyperSense essentially works. Consequently, HyperSense is designed to accelerate 3D volumetric imaging by deliberately and randomly undersampling data and then recovering the undersampled data using innovative reconstruction process. Again, this is particularly advantageous for volumetric acquisitions, and it can be combined with other acceleration techniques like ARC to guarantee optimal SNR with a very, very fast acquisition time. HyperSense provides images with higher spatial resolution and shorter scan times in a nutshell. So to summarize HD28, it's going to enhance the patient experience by eliminating breath holds for free breathing for all exams, minimize rescans for robust motion correction technique applications, provide new fast scanning solutions to assist with solving patient anxiety and claustrophobia, adapt to a wide range of patients' anatomies and scans with our new 16-channel flex coils, and also enable quiet scanning with acoustic reduction technology, or ART, and simplify and automate the adjustment of SAR for patients for implants and with implants and devices. So here we can just see exactly what you will get if you were to purchase the HD28. You would essentially reduce your downtime, which obviously is going to avoid extra cost. You're going to maximize your performance, and you are going to enhance your patient experience and adaptability. That brings us to the end of the presentation. Thank you for your participation.